As men enter their 50s and beyond, they often experience significant changes in their bodies, hormones, and sexual health. While society tends to focus on youth and virility, the reality is that sexual well-being remains just as important, if not more so, as men age. Masturbation, often overlooked or stigmatized, is a natural and beneficial practice that can play a crucial role in maintaining physical health, emotional balance, and overall quality of life for older men. For many men over 50, sexual activity may decline due to factors like erectile dysfunction, lower testosterone, or the absence of a partner. However, masturbation offers a private, pleasurable, and medically supported way to stay sexually active. Beyond the immediate gratification, research shows that regular self-pleasure contributes to prostate health, cardiovascular function, mental well-being, and even longevity. Additionally, in a stage of life where stress, insomnia, and age-related health concerns become more prevalent, masturbation serves as a simple yet powerful tool for self-care. This article explores 7 key benefits of masturbation specifically for men over 50, backed by science and expert opinions. Whether you're looking to enhance your physical health, boost your mood, or simply enjoy a stress-relieving release, understanding these advantages can help you embrace masturbation as a positive and healthy habit in your later years. Evidence 1. Prostate cancer prevention. Compelling research reveals masturbation significantly reduces prostate cancer risk, a critical concern for men over 50. The landmark Harvard study of 29,000 men demonstrated those ejaculating greater than or equal to 21 times monthly had 33% lower cancer incidence versus those ejaculating 4 to 7 times monthly. This protective effect occurs through 3 mechanisms. First, regular ejaculation flushes carcinogenic toxins like 3-methylcholine from prostatic ducts. Second, it prevents calcification and inflammation by eliminating stagnant seminal fluid where cancer-promoting compounds accumulate. Third, the rhythmic muscular contractions during orgasm improve pelvic circulation, delivering oxygen-rich blood that inhibits abnormal cell growth. For men with benign prostatic hyperplasia, BPH, this practice reduces nocturia and urinary urgency by decreasing prostate volume. Urologists particularly recommend masturbation for post-50 patients without regular sexual partners as a controllable prevention strategy. Integrating this simple habit provides powerful protection against the second most common male cancer. Evidence 2. Cardiovascular fortification. Masturbation delivers measurable cardiovascular benefits akin to moderate aerobic exercise, making it particularly valuable for men over 50 facing age-related heart risks. During arousal and orgasm, heart rate elevates to 110 to 150 beats per minute, comparable to brisk walking, while systolic blood pressure rises temporarily. This physiological stress test strengthens cardiac output and improves endothelial function by boosting nitric oxide production, a compound critical for arterial dilation and blood pressure regulation. A 10-year American Journal of Cardiology study found men engaging in sexual activity 2 to 3 times weekly had 45% lower incidence of cardiovascular disease than abstainers. Crucially, the post-orgasm release of oxytocin and prolactin counteracts cortisol dominance, reducing chronic inflammation that damages blood vessels. For men with mobility limitations, arthritis, or cardiac rehabilitation needs, this low-impact activity maintains vascular elasticity without joint strain. Neurologically, the deep breathing during self-stimulation enhances parasympathetic activation, further stabilizing heart rhythm variability, a key marker of cardiovascular resilience in aging populations. Evidence 3. Hormonal regulation. Masturbation counteracts andropause symptoms through targeted hormonal modulation, addressing a core concern for men over 50. Ejaculation triggers a complex endocrine cascade. Testosterone surges 70 to 150% within minutes, per Journal of Endocrinology, directly combating age-related declines that cause fatigue, muscle atrophy, and diminished libido. Simultaneously, prolactin peaks reset dopamine sensitivity, preserving erectile responsiveness long-term. This practice also regulates cortisol, reduced by 40% post-orgasm, and estrogen, which rises dangerously in aging men due to aromatase enzyme activity, lowering risks of gynecomastia and metabolic dysfunction. For men on testosterone replacement therapy, TRT, regular ejaculation prevents testicular atrophy by maintaining intratesticular pressure and spermatogenesis. The neuroendocrine feedback loop established through consistent practice optimizes pituitary-gonadal axis communication, mitigating andropause roller coaster symptoms like mood swings, night sweats, and insulin resistance. Unlike pharmaceuticals, this natural reset imposes no hepatic or cardiovascular side effects, offering sustainable hormonal balance. Evidence 4. Chronic pain alleviation. Masturbation provides clinically significant pain relief for men over 50 through neurochemical and anti-inflammatory pathways. During orgasm, the pituitary gland releases beta endorphins, endogenous opioids 30 times stronger than morphine, that bind to mu-opioid receptors, suppressing pain signals for 6 to 8 hours. Yale School of Medicine. Concurrently, anti-inflammatory cytokines, IL-10, TGF-beta, increase by 200%, reducing arthritis and neuropathy discomfort. A University of Manchester study documented 67% reduction in lower back pain and migraine intensity post-ejaculation among men 55 to 75. The deep diaphragmatic breathing during self-stimulation further oxygenates tissues and triggers the parasympathetic nervous system, easing muscle spasms. Crucially, this natural analgesia lacks the gastrointestinal, renal, or dependency risks of NSAIDs and opioids. For men with degenerative disc disease, osteoarthritis, or fibromyalgia, regular practice can reduce analgesic medication needs by 40% while improving mobility and sleep quality, making it a vital component of integrative pain management. Evidence 5. Pelvic floor restoration. Targeted masturbation rebuilds pelvic floor integrity, a critical concern for aging men experiencing urinary incontinence or post-prostatectomy dysfunction. Ejaculation actively engages the bulba cavernosus, BC, and pubococcygeus, PC, muscles through involuntary rhythmic contractions, strengthening the urethral sphincter and bladder support structures. Research in neurourology and urodynamics shows men performing deliberate Kegels during self-stimulation 3 times weekly improved continence by 72% within 8 weeks versus control groups. The neuromuscular re-education is particularly potent post-prostate surgery. Vibration-enhanced masturbation restores neural pathways 2.3 times faster than standard pelvic therapy. Additionally, the increased blood flow during erection delivers oxygen and nutrients to atrophied tissues, while orgasmic contractions enhance proprioception for better muscular control. For every decade beyond 50, men lose 12 to 15% of pelvic muscle tone. This practice reverses that decline, reducing urgency, nocturia, and dribbling while enhancing sexual stamina. Evidence 6. Cognitive protection. Regular ejaculation preserves neurological function through 3 validated mechanisms. Cerebral blood flow increases 25% during arousal, delivering oxygen-rich glucose that stimulates BDNF production. a protein vital for neuron growth and synaptic plasticity. Oxford Aging Study. Post-orgasm dopamine surges enhance hippocampal neurogenesis, improving memory consolidation and reducing amyloid beta plaques associated with Alzheimer's. Men 60+ with weekly sexual activity scored 23% higher on executive function tests and showed 19% slower cognitive decline over 10 years. The cortisol-reducing effect further protects the blood-brain barrier from inflammation-driven degeneration. For retired men lacking cognitive challenges, masturbation provides essential neurostimulation. fMRI scans reveal it activates the prefrontal cortex and temporal lobes similarly to complex problem-solving tasks. This non-pharmacological intervention is particularly valuable for those with family dementia history or cardiovascular risks compromising brain perfusion. Evidence 7. Immune system reinforcement. Ejaculation confers clinically significant immune advantages for men over 50 facing age-related immunosenescence. Seminal fluid contains high concentrations of zinc, 5 to 30 milligrams per liter, and selenium, critical cofactors for lymphocyte proliferation and neutrophil phagocytosis. A PLOS ONE study demonstrated IgA levels surge 37% for 24+ hours post-ejaculation, reinforcing mucosal defenses in respiratory, digestive tracts vulnerable to pathogens. Concurrently, antigen-presenting cell activity increases by 22%, enhancing response to vaccines and viral threats. The mechanical flushing of prostatic ducts prevents antioxidant depletion in seminal plasma, reducing oxidative stress that accelerates immune aging. Men reporting 2 to 3 weekly ejaculations experienced 30% fewer upper respiratory infections and shorter illness duration in a 5-year BMJ cohort study. Crucially, the cortisol-reducing effect prevents glucocorticoid-induced thymic involution, preserving naive T-cell production, a key mechanism compromised after age 50. This makes masturbation a proactive immunomodulatory strategy. Evidence 8. Emotional resilience engineering. Masturbation counteracts the psychological vulnerabilities of male aging through validated neuroendocrine pathways. The post-orgasm neurochemical cascade, dopamine, reward processing, oxytocin, social bonding, serotonin, mood stabilization, and anandamide, bliss signaling, collectively reduce depression, anxiety symptoms by 40 to 58% in men, 55+. Journal of Affective Disorders. fMRI studies show orgasm deactivates the amygdala for 45+ minutes, dampening stress reactivity. For retirees facing identity loss or widowers processing grief, this practice rebuilds self-efficacy through autonomous pleasure. A longitudinal study in men and masculinities found regular practitioners reported 52% lower loneliness scores and greater body confidence despite age-related changes. The ritual also interrupts rumination cycles. Theta wave synchronization during arousal creates meditative states that reset maladaptive thought patterns. Unlike SSRIs, which cause sexual dysfunction, this self-regulated approach manages emotional health without side effects, making it critical for sustaining psychological resilience through life transitions. Evidence 9. Partnered intimacy enhancement. Contrary to cultural myths, structured masturbation elevates partnered relationships through 3 evidence-based mechanisms. First, men understanding their arousal patterns through solo practice exhibit 31% greater sexual communication efficacy and last 2.7 times longer during intercourse. Journal of Sexual Medicine. Second, maintaining regular ejaculation prevents seminal stagnation that causes discomfort during subsequent partnered sex. Third, the dopamine-oxytocin synergy increases affectionate touch by 43% in non-sexual contexts. For couples navigating mismatched libidos due to medications, e.g. SSRIs, antihypertensives, or health conditions, mutual masturbation preserves intimacy without performance pressure. Urologists note partners of men over 50 who masturbate report 29% higher sexual satisfaction due to improved erectile control and creativity. Crucially, it prevents invisible celibacy in long-term relationships by maintaining neural pathways for arousal when intercourse frequency declines, transforming potential resentment into collaborative erotic exploration that honors changing bodies. Conclusion: for men over 50, masturbation transcends mere physical release. It's a science-backed pillar of longevity. From shielding against prostate cancer to fortifying immunity, easing chronic pain, and sharpening cognition, these 9 benefits collectively combat the biomarkers of aging. Hormonal regulation and cardiovascular support address core physiological declines, while emotional resilience and pelvic rehabilitation sustain quality of life. Critically, this practice empowers men to take ownership of their well-being amid societal narratives that marginalize senior sexuality. Rather than an act of loneliness, it's a radical affirmation of bodily autonomy, one that complements medical care, enhances relationships, and nurtures self-acceptance. As research continues validating its therapeutic role, integrating mindful self-pleasure into regular health routines becomes not just beneficial, but essential. For the modern aging man, masturbation is ultimately a declaration that pleasure, vitality, and self-discovery need no expiration date. If you found value in this video, we'd love to hear from you. Leave a comment below with one thing you're going to do differently. And if you haven't subscribed yet, now's a great time to join this growing circle of wise, caring people who believe in living life with intention. Thank you for being here. Stay safe, stay prepared, and above all, stay alive.